Do you suffer from knee pain or tension? Well, I'm Dr. Evan Schwindt, and today we're going to review an exercise to help you out with that. All right, today's exercise is going to be looking to release the popliteus muscle. Now, if you have ever suffered from or currently suffer from knee pain or tension, or even a knee dysfunction in the sense that you're having a hard time stabilizing your knee, there's a very good chance that the issue is actually coming from the popliteus. This is a very small but powerful muscle, and often unaddressed. A lot of us think, okay, because I have knee discomfort, there must be something going on in the front side. But if you look at it anatomically, it's really just bone and a little bit of skin there. There's not much nerve, artery, or vein. So if you go to the back side of the knee, that's where you have a huge fossa, big space for nerves, arteries, veins, muscles. You get your whole gastroc or your calf muscles coming up, your hamstring muscles and tendons coming through this area. This is a spot that has a lot of sensitivity when you dig into it, but you may not have even noticed it up until this point. So if you have any pain, dysfunction, derangement, or tension through the knee, there's a very good chance there's something going on the backside. So let's show you how to release that. Now, the popliteus is a very tiny muscle, as I mentioned. It starts on the lateral outer part of your shin and goes slightly diagonally, like a triangle, towards the medial aspect. Its primary function is the first muscle actually that activates flexion of your knee. So you think about it, going from a standing position down to a seated position. This muscle is the first one. Now in open chain kinematics, it also rotates your tibia medially. In closed chain kinematics, it laterally rotates the femur in the initial phase of flexion of the knee. Super important muscle here, so what you want to do to get into it, I like to utilize two thumbs like so, and you're going to put it right in the back part of your knee. Common fault here is people go down into the upper calf. I want you to think of your thumbs pushing up towards your kneecap. With that, I like to also press on the front of my kneecap and pull them in together. Now, if you have really big or tight calves, you're also going to want to take those calf muscles, push up your thumbs, split them apart a little bit, and then get in behind it. Otherwise, you're just doing a calf massage or you're feeling like your thumbs aren't getting anywhere. So, you get up in there, you're pushing up towards the kneecap. You're going to know you're on the right spot because it will be tender. If it's not tender, you're not on the popliteus. Once you're in there, you can either do cross fiber friction, just moving it side to side, or if that becomes easy, you can start to hold into it and straighten your knee out. So you can do this seated like I'm doing right now on the ground, on a chair, laying on your back with your knee up in the air, or if you're having a hard time getting your fingers and thumbs in there, you can throw a lacrosse ball behind the knee, then bend it up so that way there's pressure, and then work on ankle circles throughout to stretch it out. All right, I hope you enjoyed. Take care.